Namaste everyone. I myself, JVN Abhishek Kumar, lecturer at Faculty of Pharmaceutical Sciences, Jyoti vidyapeeth, Women University, Jaipur. Today we are going to read detail about acidifying agents and GI GI agents, gastrointestinal agents. So already we learned about acidifying agents, acidifiers, antacids, protective, absorbent, laxative, cathartic, and progressive. These are the agents we already know little bit. Now we are going to read in detail what this agent going to help and how it's help to reduce the acid level inside our GIT, gastrointestinal tract. So first we are going to read about acidifying reagent or acidifiers. So already we know about acidifying agent or acidifier. It is a such type of agent which help to increase the acidity of stomach so that it can balance the acid enzyme reaction. Metabolic acidosis will be maintained after taking this compound, this substance in the form of drug or medicine. Acidifying reagent or acidifier. Here are some examples of gastric acidifier. Dilute hydrochloric acid, urinary acidifiers. There are types of acidifying agents. So gastric acidifiers, urinary acidifiers, systematic acidifiers, and acids. These are basically four types: gastric acidifiers, urinary acidifiers, systematic acidifiers, and acids. And then we go for antacids. So why we need antacids tablets? We already discussed in previous lecture that if our body or GI tract having excess of acids or excess of acid secretion in GI tract, then to minimize the concentration or to maintain the balance of acid inside the stomach, we need an antacid tablet. An antacid tablet neutralize the excess acid secreted in our stomach and acid base reaction take place, formation of salt and water take place. So antacids are nature, antacid having nature in alkaline. So alkaline means basic nature of that particular tablet, and acid will react to form salt and water and our body get relief that time. So here absorbable antacids, sodium bicarbonate is used, non-symmetric, systematic or non-systematic. There are two types of antacids, systematic and non-systematic. Non-systematic means non-observable and systematic means observable. So aluminum containing antacids, not in calcium containing antacids, magnesium containing antacids, and combination of antacids preparation. So there is a aluminum used as a base material of antacids tablet. Calcium used as a base material for formation of antacids tablets. Magnesium used as a base of antacids tablets. So in the form of aluminum hydroxide, in the form of aluminum phosphate, in the form of calcium carbonate, in the form of tris basic calcium phosphate, magnesium carbonate, magnesium hydroxide, and aluminum hydroxide gel and magnesium hydroxides, aluminum hydroxide gel and magnesium trisilicate. So these are the types of antacids salts which helps to minimize the hyperacidity, high acidity concentration inside the human body to uh, help to reduce the ulcer problem of GIT. Protective and absorbent. A bismuth compound is used as a bismuth subcarbonate, bismuth subnitrate, laxative, and cathartic and progressive. These are the similar function. Laxative and cathartic have same metabolic action and progressive have different metabolic action in GIT. So laxative and cathartics also, here some drugs are liquid paraffin, glycines, used as a lubricant. Methyl cellulose and sodium CMS used as a bulk progressive. So these are the few examples here. Acidifying reagents and acidifiers. So already we know that these are the drugs and agents which are able to increase the acidity in GIT. Some drugs are used to increase the metabolic acidosis, whereas some of these are used to increase the gastric hydrochloric acid. And they are also known as acidifying reagents and acidifiers. Gastric acidifiers, these are the drugs which are used to restore temporarily of acidic of stomach in a patient suffering from hypochlorhydria. So when the acid concentration will decreases in GIT, that time we need gastric acidifier. That time what we need? Gastric acidifier. Say one more time, gastric acidifier is needed when our body, when human body will secrete less amount of acid, uh, less amount of acid. That time, gastric acidifier are used to treat that patient suffering from hypochlorhydria. Urinary acidifier, these are the drugs which are used to treat acidic urines. Enable to treatment of some type of urine tract disorders. When concentration of uric acids, we can say that normally concentration of uric acids or urine tract having some type of disorders, that time we need urinary acidifiers. Systematic acidifiers use to neutralize the alkaline body fluids and particularly blood in a patient who are suffering from systematic alkalosis. Means if a person is suffering from alkalosis, what it means? A person having excess amount of alkaline compound in his body, that time we need systematic acidifiers. Systemic acidifiers, systemic acidifiers, systemic acidifiers. These are the drugs which neutralize the alkaline bodies fluid. And acids are used as a pharmaceutical aids in a preparation of laboratory and quality control. So these are the few examples of acidifying reagents. Property. What are the properties of acidifying reagents. So they are white, fine, crystalline powder, odorless, full saline test, soluble solution of 0.8% of aluminum chloride in isotonic with serum. Freshly prepared aqueous solution are neutral to litmus but become quickly acid on standing because hydrolysis. Dilute sulfuric acids. So formulation. In formula, molecular weight equal of dilute sulfuric acid equals to 36.46 and 10% weight by weight. So ingredients of hydrochloric acids and purification. Hydrochloric acid, commonly known as a spirit of salt, because it was first of all prepared by distilling sea salt with a sulfuric acid, and it is an aqueous solution of hydrogen chloride in a water. It is having not less than 35% weight by volume and not more than 38% of HCl. Preparation. It is manufactured by the action of sulfuric acid on sodium chloride. So when sodium chloride and sulfuric acid react, then form HCl. During manufacturing caustic soda by electrolysis of sodium chloride solution, large quantity of hydrogen and chlorine are obtained as a byproduct, and these gas combine to yield hydrogen chloride. Property. It is colorless liquid, strongly acids, and it is miscible with water, alcohol, while a specific gravity of 1.18. It is a strong acid and attack metals, forming the hydrochloric chlorides and with evolution of hydrogen gas. It should store in well-closed container of glass and other material at room temperature, not excess 30 degrees C. Use. It is used in pharmaceutical aids as acidifying agent. It used as gastric acidifier when the level of hydrochloric acid in gastric juice will low. Extremely used in solvent or catalyst in the basic pharmaceutical and as acidifier. Antacids. These are the drugs which are usually alkaline substance and are used to neutralize the excess acid in the stomach. Already know that our stomach, the concentration of acid will increase. That time we need alkaline substance to maintain acid and base reaction. So when acid and base reaction take place, then salt and water formation take place. So antacid having alkaline nature, and that alkalinity of antacid neutralize the stomach acid, and the patient suffering from hyperacidity get relaxed, a condition in which the level of acid in GI tract is increases and the excessive acid and causing discomfort to the patient. The production of gastric HCl is continuous process. It means that the antacid is also used in a continuous process. So for a fixed time, we need after fixed interval, we need antacid because to maintain the acid concentration in body, after some time the acid concentration will increase. That time we don't have extra alkaline substance, and to minimize that acid concentration, again we need antacids tablets. So a strong alkaline base will damage the mucosal layers. So keep it in mind that we always take low power of antacids so that mucosal layer will be not damaged. Action of antacids should be gradually without evoking beyond acidity. Also, antacids should not have any side effects. Antacids give symptomatic relief from the pain and neutralize the excess hydrochloric acid. Antacids are classified as follow: systemic, absorbable, non-systemic, non-absorbable. So these are soluble and readily absorbed and capable for producing systemic electrolyte alternate in alkalosis. Non-systematic means not absorbed. So there are few examples: aluminum containing antacids, calcium containing antacids, magnesium containing antacids, and combination of antacids prepares. Ideal requirement for antacids. Ideal requirement for antacids. Ideal requirement for antacids. Why we need to take antacids tablets? It should be insoluble in water and have fine particle form. It should not be absorbed or cause systematic alkalosis. It should be able to excrete it affect gradually over period of time. It should not be a laxative or cause constipation. It should not cause any side effect. It should not be stable and readily available. The reaction between antacids and gastric hydrochloric acid should not be proceed large volume of gas. Antacids should probably inhibit the protective enzymes. How we can prepare aluminum hydroxides gel. So for making aluminum hydroxide gels, we need sodium bicarbonate and potassium. We can react sodium bicarbonate and potassium with water, then form aluminum hydroxide, and alum solution is added to the solution of sodium bicarbonate, not vice versa. Properties: it is a white viscous suspensions. Aluminum hydroxide gels gives popular antacids and bring about neutralized gastric acids. So we can stop here today.